Welcome back to Senior Health Quizzes, the quiz that keeps your mind sharp and your body healthy after 60. My name is John, and for today I prepared a quiz about heart health since this is the #1 senior killer, claiming one life every 33 seconds in the US. But the good news is that up to 80% of heart problems are preventable, and today's quiz will make sure of that. With these 20 questions, you learn exactly how to protect your heart and spot warning signs before it's too late. Let's look at question number 1.
All right, starting off, what is considered a healthy resting heart rate for adults over 60? Is it A, 40 to 50 beats per minute, B, 60 to 100, or C, 100 to 120? The correct answer is B, 60 to 100 beats per minute. This range is considered normal for most adults, including seniors. However, many people on heart medications may have a lower resting rate, which is also fine if your doctor approves. Now, question 2. Which of the following is the most common heart attack symptom in adults over 60? A, sharp stabbing pain in the chest. B, pressure or squeezing in the chest. C, pain only in the left arm. If you said B, you got it right. Most heart attacks feel like pressure, squeezing, or fullness in the chest. That sharp stabbing pain people expect from movies. That's actually less common in real life. Moving on, at what blood pressure reading should seniors become concerned? Is that A, 110/70, B, 120/80, or C, 130/80 or higher? The answer here is C, 130/80 or higher. According to the American Heart Association, this is now considered stage 1 hypertension. Now let me share something important here. High blood pressure used to be defined as 140/90, but that changed in 2017. The guidelines were updated because research showed that damage to arteries and organs begins earlier than we thought. For seniors especially, this matters. As we age, our arteries naturally stiffen, making high blood pressure more common and more dangerous. A study published in the Journal of the American College of Cardiology found that adults over 60 with blood pressure above 130/80 had a 25% higher risk of heart attack and stroke compared to those below that threshold. So if your readings are creeping up, don't wait. Small changes like reducing sodium and walking daily can make a real difference. Question 4 coming up. Which type of cholesterol is known as the good cholesterol? A, LDL, B, HDL, C, triglycerides. That's B, HDL. High-density lipoprotein helps remove bad cholesterol from your bloodstream. You want this number higher, not lower. Let's keep up the pace. Next question. How often should adults over 60 have their cholesterol checked? Every 5 years, every 10 years, or every 1 to 2 years? Those are your options, A through C. The right answer is C, every 1 to 2 years. After 60, cholesterol levels can change quickly, so regular monitoring is key. Don't wait for a problem to show up. Let's keep going. Which of the following foods is best for heart health? Your options are fried chicken, white bread, or salmon. If you picked C, salmon, you nailed it. Fatty fish like salmon are packed with omega-3s, which reduce inflammation and lower triglycerides. Keep track of your score, and when we're done, drop your number in the comments. I really want to see how you did. Alright, question 7. What is the main cause of coronary artery disease? A, lack of sleep. B, plaque buildup in arteries. C, drinking too much water. The answer is B, plaque buildup in arteries. Over time, cholesterol, fat, and other substances form plaque that narrows your arteries and restricts blood flow to the heart. Next question, and this an important one. Which symptom is more common in women having a heart attack compared to men? Is it A, chest pain, B, nausea and fatigue, or C, left arm pain? B is correct, nausea and fatigue. Women often experience subtler symptoms during a heart attack, which is why many cases go unrecognized until it's too late. This is actually critical to understand, especially for the women watching and the men who care about them. Research from the American Heart Association shows that women are more likely to experience shortness of breath, nausea, vomiting, and back or jaw pain during a heart attack. Classic chest pain still occurs, but it's less dominant than in men. A study from Yale School of Medicine found that women under 55 were 7 times more likely than men to be misdiagnosed and sent home from the emergency room during a heart attack. 7 times. So if something feels wrong, advocate for yourself. Don't let anyone dismiss your symptoms just because they don't match the textbook. Question 9. Which activity is most beneficial for heart health in seniors? Sitting in a sauna, lifting very heavy weights, or brisk walking for 30 minutes? C is the answer. Brisk walking for 30 minutes. Moderate aerobic exercise like walking strengthens your heart without putting excessive strain on aging joints. Question number 10. And we're already halfway there. What does atrial fibrillation mean? A. A heart that beats too slowly. B. An irregular and often rapid heartbeat. C. A completely stopped heart.
B is correct. An irregular and often rapid heartbeat. Atrial fibrillation, or AFib, is very common in seniors and increases the risk of stroke significantly. Question 11. Which of the following increases heart disease risk the most? Is that A. Drinking 1 cup of coffee daily, B. Being 10 pounds overweight, or C. Smoking cigarettes? The answer is C. Smoking cigarettes. Smoking damages blood vessels, raises blood pressure, and reduces oxygen in your blood. No other habit comes close to this level of harm. Let me put this into perspective. According to the CDC, smokers are 2 to 4 times more likely to develop heart disease than non-smokers. And here's what many people don't realize. The benefits of quitting start almost immediately. Within 20 minutes of your last cigarette, your heart rate drops. Within 12 hours, carbon monoxide levels in your blood return to normal. After 1 year, your risk of heart disease is cut in half. A study from the British Medical Journal followed adults who quit smoking after age 60 and found they still gained significant life expectancy compared to those who continued. It's never too late. If you're still smoking, today is the best day to stop. Moving forward, what is the recommended daily sodium intake for seniors with high blood pressure? Less than 1,500 milligrams, 2,500, or 3,500. A is correct. Less than 1,500 milligrams. That's about half a teaspoon of salt. Most processed foods contain far more than you'd expect, so reading labels is essential. Question 13. Which of these is a warning sign of heart failure? A. Increased energy. B. Swelling in legs and ankles. C. Weight loss. The answer is B. Swelling in legs and ankles. When the heart can't pump efficiently, fluid builds up in the body, often starting in the lower extremities. Okay, next one. How does aspirin help some people prevent heart attacks? Does it lower cholesterol, reduce blood clotting, or strengthen the heart muscle? B is correct. It reduces blood clotting. Aspirin thins the blood, making it less likely for clots to form. But don't start taking it without talking to your doctor first, as it's not right for everyone. This is a perfect example of why you should never self-prescribe. For decades, daily aspirin was recommended for almost everyone over a certain age, but guidelines have changed significantly. In 2019, the American College of Cardiology updated its recommendations, stating that adults over 70 without existing heart disease should generally not take daily aspirin for prevention. The risk of internal bleeding, especially in the stomach and brain, often outweighs the benefits for people who haven't already had a heart attack or stroke. However, if you've had a cardiac event, aspirin may still be crucial. The point is, what works for your neighbor might not work for you. Always consult your doctor before starting or stopping aspirin therapy. Question 15 now. What effect does stress have on the heart? A. No effect at all. B. It lowers blood pressure. C. It raises blood pressure and heart rate.
C is the answer. It raises blood pressure and heart rate. Chronic stress keeps your body in fight or flight mode, which strains your cardiovascular system over time. Let's continue. Which drink is best for heart health? Is it A, diet soda, B, fruit juice with added sugar, or C, water? Again, the correct answer is C, water. Staying hydrated helps your heart pump blood more easily. Sugary drinks and energy drinks can spike blood pressure and add empty calories. Question 17. What is the link between sleep apnea and heart disease? Your choices are no connection, it lowers heart disease risk, or it increases heart disease risk. C is correct. Sleep apnea increases heart disease risk. When breathing stops repeatedly during sleep, oxygen levels drop, putting stress on the heart and raising blood pressure. Sleep apnea is far more dangerous than most people realize, and it's extremely common in adults over 60. The American Heart Association estimates that 40 to 80% of people with cardiovascular disease also have sleep apnea. When you stop breathing during sleep, your body releases stress hormones that increase heart rate and blood pressure. Over time, this leads to inflammation, arterial damage, and a higher risk of heart attack, stroke, and irregular heartbeat. A study from the Journal of the American College of Cardiology found that untreated severe sleep apnea doubled the risk of cardiovascular death. The tricky part is that many people don't know they have it. If you snore loudly, wake up tired, or your partner notices you gasping at night, talk to your doctor about a sleep study. Treatment with a CPAP machine can dramatically reduce your heart risk. Now we are almost there. Finish these last few questions. What percentage of your plate should be vegetables for a heart-healthy diet? A. About 10%. B. About 25%. C. About 50%. The answer is C. About 50%. Filling half your plate with vegetables provides fiber, vitamins, and antioxidants that protect your heart without excessive calories. Question 19. Which of the following is a silent symptom of heart trouble in seniors? Extreme thirst, feeling unusually tired for no reason, or sudden hair loss? B is correct. Feeling unusually tired for no reason. Unexplained fatigue can signal that your heart is struggling to pump blood efficiently. Many seniors dismiss this as just getting older, but it deserves attention. Final question. What should you do if you suspect someone is having a heart attack? A. Wait and see if symptoms improve. B. Give them water and let them rest. C. Call 911 immediately. The answer is C. Call 911 immediately. Time is critical during a heart attack. Emergency responders can begin treatment on the way to the hospital, which significantly improves survival chances. Never wait it out.
That's all 20 questions. If you learned something new today, tick that subscribe button and give this video a thumbs up. It helps more than you know.